when you're given a condition from your patient, it's not like you already know what it is, diba? When you're
Yeah.
given a condition with your patient, and then you see that there are symptoms that aren't consistent with the diagnosis, that's when you have to associate it with other conditions. And by doing that association, you are now essentially differential diagnosis.
How did you get your Doctor of Physical Therapy degree or your ongoing, right? And can you take them online or on site? So what are the advantages and the disadvantages?
Okay. So when we talk about the DPT degree, is that how did I get it? How did I file for it? So I'm with an agency. So the
Mhm.
agency helps process for things. So the processing that was done for the NPT, that was left to them. All they did was they would ask us what are the what they need to file to open an account, maybe for FSBPT or the FCCPT, which is the credentialing agency and the bodies for issuing the exam. So
Mhm.
counterpart to our PRC here in the Philippines.
Yeah.
So that's the counterpart. Okay. So with that, you now have the pieces of information. You have the paperworks in a sense. Yeah,
Mhm.
paperworks to be
Yeah.
given. And then this thing is the FCCPT. So when you file for that in your NPT, the universities in the US, because I'm with the US university, they need your information. They need your TOR, transcript, your diploma as proof that you have graduated from the course. And they need the information to be credentialized. That's not the
Yeah.
right
Is
term.
that
To
West?
be processed. Hmm?
Yeah. West ba to? Was
It
it West?
depends. There are different kinds of credentialing agencies. There is CGFNS, there is FCCPT. There are different few. I only know those two because those are the ones that I commonly hear, and I'm FCCPT. So
Mhm.
in the college that offers the DPT, they would request the FCCPT to release your papers so that they can get your information to see what are the accredited units.
Mhm.
Now, there are deeper terms for that, which I can't really divulge in detail. There's CWT5, CWT4, CWT6. I am at CWT5, but the current is CWT6. So by that logic alone, there is a difference in the units, which is why I
Subjects.
still
Yeah.
have to take some subjects, basically for me, genetics and nutrition and imaging.
Imaging. Yeah.
Because these are topics or these are courses that weren't offered back in my time, during our time in Audrey, when we were in college. We didn't have that.
Very
And in
unfortunate.
fact, you're very unfortunate. So we have to take that. And there are ways to take that. There's PRI, or we can go to an online, what do you call this,
School.
online school for that. But
Yeah.
basically, PRI is the best because PRI has been doing it for already 2 years for physical therapists. Physical therapists get up to
Okay.
date with their units sa US, because during the time when physical therapy was converted into DPT, the highest educational attainment or requirement for physical therapists was master's, and then it got bumped up into doctorate, which
Doctorate.
is why PRI open courses, technically short online courses, for you to get up to date with those information. So now going back to how I applied for DPT. So DPT, it was processed by the agency. The agency has an allied school. That's a school that they have been in contact with. They have an agreement with to where their scholars would go through. But it's not simply just going there and being accepted. So you know how you see in the movies, diba? I felt like it was in a movie. In the movies where you have to send letters, letters of letters
Oh,
you want to be, I would like to be part of your program and all that with this
yeah.
dramatic
Yeah.
lettering and all that. You have to
Applying.
be
Yeah.
accepted into the school. When you apply to the school, you send a letter of intent, you have to send your credentials, and then you will expect an email, fingers crossed, a week later to see if you were accepted in that school. Well, good for me. I saw the letter and it says we'd be happy to have you in our program. So there are actually limited slots. I didn't know
Yeah.
that.
I knew
I'm
I
lucky.
I heard it was quite competitive also to get in
No,
specific.
I didn't realize it was that competitive until I read the letter that, oh, so apparently they had limited slots. Wow. And I think another point that helped me get into that was because I had an agency to back me up.
Mhm.
So having an agency to back you up helps with many things. For example, your visa. So if you need to take your visa when going to NPT, if you have an employment or employer backer, you're more likely to have your visa approved rather than self applied or self, what do you call that? If you just do it
Do it
through self,
independently. Yeah.
independently. That's the word I was looking for. So with that, once I got the letter, shoot, game, I'm in. So we have the employment registration. So in the registration, that's when we register into the subjects or the classes that we are in. And I'm currently on my third semester because for DPT they are not counted in school years, unlike here in the Philippines. But in the Philippines you have school years. School years is one semester, first semester, second semester.
Yeah.
But theirs is not really a school year, rather a trimester. It seems
Yeah.
like every semester is different. It's not like here in the Philippines where in 1 year your first semester subjects will carry over to your second semesters as a prerequisite of some. There are some topics like that, but generally first semester separate subjects to the second semester. And in fact, in each semester, in the semester for physical therapy, we have midterms and finals, di ba?
Mm-hmm.
Midterms and finals. A semester in the doctorate, and I assume, I guess, for US in general, but I can't say for certain, but it's what I went through. First semester is divided into not midterm or finals, it's called sessions. Session 1, session 2. Now, session 1 is one subject, and then you pass that subject, you're done. Then you go to session 2, a different subject, and then you're done. And that is one semester. So if you notice, they're not prerequisites for the next, unless you are specializing, which I am. And in specialization, you need clinical decision making before you can take either orthopedic, geriatric, neurologic, pediatric physical therapy. So with that, that's pretty much how it goes for getting into Doctor of Physical Therapy from an agency route.
Okay.
Okay.
So, what do you think are the advantages and the disadvantages? Because I'm not sure how much it costs, like from the tuition and from the stay. I just know that doing an on-site DPT is more, of course, expensive because you're not staying in the Philippines as well. So, I think one of the advantages of online DPT is that you're here in the Philippines, so you can also work while you're studying, right?
Yeah, because that's me right now. So yes,
Yeah.
an advantage of having to go through the online DPT is that you can work at the same time because as I told you, you have to take subjects in the first session of the semester, then the second session. So here's the thing. So if you're talking about the monetary or how much it costs, I would say that the amount of start first with the processing. Yeah, you have to shell out a lot of money for the processing to get accepted in the first place. But if you're talking about the actual school, the tuition during the semesters themselves, I would say it's pretty much the same as to how much you would be taking here in the Philippines. For example, from when I graduated, the tuition at that time was around 38 to 40K per semester. Excuse me, semester. And then you had 2 semesters, diba? So technically in one school year, you would to shell out around maybe 80 to 100K, diba?
Yeah.
So in the DPT, one semester is approximate. I can't say dollars. I forgot the exact dollar amount, but it's approximately the same amount. It's 45. Let's be 45 to be safe. 45K per semester. But here's the thing. The semester in physical therapy here in the Philippines was about 20 subjects, diba?
In
20
one year?
subjects. But in the US, no, in a year, sorry, in a year. But if you
Yeah,
say
yeah, yeah.
one semester, mga 10 to 12 pala, sorry, 10 to 12. But in the US, there's only 2. So you get it?
Yeah.
If you see it, we are spending the exact same amount for one semester here in the Philippines and there in the US. But the difference there is that we have around 10 subjects, but they only have 2. So if you look at it, technically it's more expensive
Yeah.
because one subject unit alone is already equivalent to half of the 5 subjects that we took here in the Philippines. Cool. So
Yeah.
that is with regards to the money aspect of the DPT. With regards to the time, the online advantages, yes, it's advantages online, but personally, I feel that it would have been you could appreciate it more if it was live. I think everybody sort of feels this right now because currently, as we're having this interview, this is the time during COVID pandemic where everything is online learning. The the stress of online is different from the stress of live, and the appreciation of the knowledge in online is different from that from live. Like in live, you can really feel the presence. And if you have a case presentation, you're sitting there with your peers and the tables, and you see a slideshow presentation of your professor talking about it. That would, I would say, be more magical. But here, of course, you have that. But you're still thinking about other things during the class because the class you have sorry, neighbors are kind of loud.
That's okay.
So in the class you have your lecture and you see of course a slide and they present the case presentation, but the essence doesn't feel the same for me. Although I am learning a lot, don't get me wrong, I am learning a lot and I'm amazed at to what they know and what they have to go through. Like, oh wow, this is pretty much deeper than what I encountered here in the Philippines. Yes, there's different information, but then again, I would have preferred it if it were live. But I'm not going to squander the opportunity of having to take it online because, as I said as well, I'm working. So with that, I'm able to earn at the same time while being able to study. So I'm still getting my education and I'm still getting my earnings. But the important takeaway here is that it's how seriously you take. Same with college, same with review. It's how seriously you take the information. If you're really if you're really taking it seriously, you it doesn't really matter if it's live or online.
Yeah, that's very true. Yeah, whatever works.
Okay.
As long as you do something about it, like you just put, yeah,
Whatever
you just do
works.
your best. Yeah. Okay, so what's the difference between
Yeah,
a physical
definitely.
therapist, yeah, and a doctor of therapy?
People might have different opinions as to how I would describe the difference.
Mhm.
So, what I say right now, disclaimer, is not tried and true or the same for all.
Yeah.
But the way I see it is this. When you say physical therapist is a practitioner of physical therapy. Okay? When you say doctor of physical therapy or DPT, that is an educational degree. Meaning, physical therapist is anybody who practices. Simple as that.
Hmm.
When you say DPT, is the educational degree or your educational attainment in that process. Because in the Philippines, we have a bachelor's degree in physical therapy. So you just change the words. Instead of bachelor's, it's doctor. So doctoral degree in physical therapy, which is
Hmm.
why they're technically the same thing. It's just the image education because a doctor of physical therapy can be a physical therapist. That's cool. But not all physical therapists are doctors of PT because not everybody is up to date, especially those. I have classmates in my DPT program who are 20 years in practice, 10 years in practice. One is from Egypt from 10 years in practice. One is in the US, 20 years practice. Another one was in India, 7 years of practice because their educational attainment at that time, DPT was not available.
Yeah.
The highest that you could get was a master's in physical therapy. And when APTA, the American Physical Therapy Association, along with the American College of Sports Medicine, put into agreement into leveling up the level of education for physical therapy, that's when they went with the doctor of physical therapy. But because of the sheer amount of physical therapists that are currently practicing, if they were to just negate all of their hard work, the system would come to a standstill and fail.
Yeah.
They can't do that. Otherwise, the physical therapy would cease to exist. So with that, there is a transitional degree. So I'll start discussing about the difference of DPT and transitional DPT because people are confused.
Yeah.
Are they different? Generally, they're the same thing. For me, they're generally the same thing. They are educational degrees, but the manner in which you get them is different. Okay? Because let me get back to it. Huh? Let me get back to it. I mentioned that let's say, um, there are many people who are taking their degree in physical, or sorry, there are many people who already have their degree in physical therapy, but they didn't have DPT at that time. Currently, the bachelor system of the physical therapy is erased from the US, meaning there is no bachelor's degree in physical therapy. What you need to do in order to get your DPT in the US is you take a prerequisite course. You take BS, Bachelor of Science in Sports Movement, Bachelor of Science in Kinesiology, Bachelor of Science in Anatomy, or something like that, something along the line of those, before you go into physical therapy, which is a doctoral degree. So it's similar or in counterpart to saying you're taking your pre-med course as maybe a med tech, and then you are going into medicine to become a doctor of medicine. See the difference or see the
Yeah.
similarity?
Yeah.
So that is the thing, which is why people who graduate as doctors of physical therapy are allowed to call themselves doctors. But in order to be socially correct and not to misconstrue or give a misunderstanding with their patients, it is appropriate to say, I am a doctor of physical therapist, I am a doctor of physical therapy, rather than just saying doctor, because they'll think, so you can prescribe medicine. But no, we can't prescribe medicine. There's a clear distinction of that. So if I were to say, it's similar to this. When you see a chiro takes how many years of education practice? They're still doctors, diba? About dentists, they how long is dentist? 7 years by 8 years?
7 years.
I forgot.
Yeah, 7 years.
7 years, I think. I'm not sure if that changed now because of K-12. But the idea there is that after they graduate, they're still doctors. So doctors of medicine are not the only doctors there are. But majority of the doctors that people know of are them. They are physicians, which is thus when you graduate medicine and take the licensure examination, you are a physician as your occupation, doctor of medicine as your educational degree. Same with physical therapy. You are a physical therapist, you are licensed to practice physical therapy, but your degree is, for us, let's say bachelor's degree, or your degree is doctor of physical therapy. And that leads you to think, sir, if that is the case, if that is for DPT, why is there existence of tDPT? The fact that it sounds different means that they're different. They're the same with regards to the status of education number of units, because the tDPT is to transition a person who has already graduated physical therapy. Gets?
So
You see
basically,
the,
it's for
the
us, right?
combination there?
Yeah.
Yes, it's basically for everybody outside of US,
Yeah.
because in outside of US, nobody offers Diretso DPT. Diba? Everybody graduates from Bachelor of Science in Physical Therapy, can possibly get a master's, but there is no DPT. In fact, in the US, in the Philippines, we our offerings of FEU, they have ally with the US, or they have contact with the US for offering a DPT program. Same with Southwestern University. They offer, what do you call that? They are in I forgot
Utica College in New
what
York.
US school, but they're not Utica, diba?
Yeah.
Okay, so they are we in schools here in itself are not the ones offering the DPT. They are providing access to the DPT, which is still US. Thus, it is still a transitional DPT program because you are graduate of physical therapy, bachelor's degree into the doctoral equivalent. That's why when I graduate, I'm not supposed to be calling myself just DPT. I should be putting myself as tDPT because it's a different route. But when we talk about putting it in your name, what do you call this? Putting it, example name, Kristan Jason D. Rosario, PTRP, RPT, DPT. There's no need to put the T there anymore. But if you're to introduce yourself, or if you put it in legal documents, then you have to indicate that it's a transitional degree. So they are aware that you graduated from a bachelor's of science and then got into the doctorate, rather than straight to doctorate with the initial degree, because they might put that into consideration in your employment status.
Okay.
Oh, that was a lot.
Yeah, that was a lot, but I learned a lot also. What school did you enroll in eventually? Yeah. So,
Because of my agency,
yeah.
I went with Arcadia University, which is in Pennsylvania.
Yeah.
So the time difference there is 13 hours. Currently 13 hours because of daylight savings, right?
Yeah,
I have to
daylight.
take note of that so I don't get late to class. So yeah, I am with Arcadia University. And what's nice about Arcadia is it's actually a relatively new school.
Mhm.
I'm not really sure, but it's from how I see it. And they are pretty inclusive because majority of their students are really from outside, really from the outside. So they even have like it's interesting because it really feels like a school. If it were live, you would have like intramurals, you have a sports fair. They even
Yeah,
have like center for wellness and mental wellness something. I forgot. But
yeah,
so they have like here's a group. You're invited to more like if you're in Facebook, you have a group chat and these group chats had
yeah,
different functions. So it's like that. Each of those departments offer like seminars. They offer although I'm not really active with those because I don't really, I'm kind of busy. But if you're a full-fledged student, you can really opt to join people with their talks. And then they also send you emails often about what are their current programs, such as expanding the university. Um, for example, on February, they have this like love fair or something, and they give you special messages, or they just it's just a wholesome thing rather than just merely a school or school in itself. So I find that pretty cool as well.
So how many years does
They
it
even
take to complete via Arcadia University?
actually, um, it would take about 18 months to 2 years. But for
Mm-hmm.
me, I'm going for the 2 year route because in order to go 18 months or less, or even earlier than that, you can even graduate like before 18 months, maybe a year if you really plan it well,
Yeah,
because you have to plot your schedules. And if it just so happens that you took this subject and then in the next semester or in the semester after that, they don't offer anything but that subject you already took, you have an off season. I think people have that problem for especially for irregular students in school. Like you already had the subject, but they don't offer it in this first semester. They only offer it in the second
yeah,
semester. You will take an academic break, diba? So with that, you have to plot your schedule. You really have to look at the school year, how many subjects or which are the subjects that you need. And you have to check if where are the redundancies of these subjects. So you know that, or you ensure that, oh my God, doggy, you ensure that you don't end up having too long of a break or nagay kulang na time. Because
yeah,
if you can ensure that each session has a subject in between, you'll be done on time. I'm doing that, but I am not opting to overload because you can overload. Diba I mentioned that you have two
yeah,
subjects per semester, one during the first session, another during the second session. That's one semester. But they give you the option to overload, which is to add one more subject. So that the max you can do in one semester is three subjects. So if you do three subjects, three, three, and then you have like maybe 12 subjects to get, just 12. Let's say just 12. Three, 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 three. Then that technically means that you have one, two, three, four. Four semesters to go through. Diba? Just an
yeah,
example. Just an example. But me, I'm not overloading because when you overload, remember, I'm working at the same time studying for my DPT. And if I were to overload, I might end up getting overwhelmed in a sense. I'm sure kaya na ako, but then I don't want to put myself in a situation where I'm always on a deadline.
yeah,
Because
yeah,
personally, and if I'm already overloaded with my work and then I still have DPT, which is just as important as work, what am I gonna do? So I have to ensure that it's within my capable hands, chart, within my capabilities in order to organize my plotting for the year. For example, my classes are usually at Wednesdays at 7 a.m. So Wednesday 7 a.m. 7 to 8 ang class, online class na live. But they have synchronous and asynchronous, meaning you have to be
yeah.
there during the lecture. Okay? Then
Mm-hmm.
after the lecture, you have homework to do. So you have homework and assignments and quizzes. So in the homework, they will have you, let's say, research a study. You have to look into a study in PubMed, the most recent maybe 5 years at that time, which is related to your case. So you have a case which is
Mm-hmm.
involving upper extremity conditions, maybe an elbow problem. So with that elbow problem, you have to look for a study regarding that and state how that study will be useful for that patient with that condition. So
Okay.
that's an assignment. Then you have a discussion board. A discussion board is basically in an actual school, you get to discuss with other people about, example, this is the case, you have a grouping with the people, and then in this case, you will discuss how this certain condition, how will you treat it, how will you tackle it. In a
Mhm.
discussion board, the professors will give us a question, and that question can pertain to anything involving of the topic that was being discussed. Let's say, for example, my orthopedic class. In my orthopedic class, the topic at this time was about, so you see there so many people posting their own experience and expertise, and that is another avenue to learn. Because what? These other individuals have been in practice for about 10 years, 20 years, and it gives you an idea of, oh, so this is how they've been doing it, especially if you haven't encountered that case. I, for one, haven't treated a pregnant lady with a lordotic issue with low back pain, which leads me to think, like, how am I going to deal with that when the time comes? And here comes a person who actually treated that condition and has outlined his or her program and given the evidence to provide that these are effective for that patient. And aside from that, they saw the progression
Mm.
themselves. So
What does the path towards the DPT look like compared to an MD? So are there fellowship degrees also for